Hello, and welcome to the 2021 Employee Benefits Open Enrollment for the City of Hendersonville. My name is Mike Dodd. I am one of the insurance consultants that works with the city to help put together the best employee benefits package that is absolutely possible for you. This year, due to social distancing, we are continuing to hold our informational meetings virtually. So we are recording this video so that you can watch the presentation. In addition, you will have several opportunities to meet with either me or someone from my office to answer questions that are personal that you would like to discuss one-on-one. That meeting schedule will be provided by HR, and we will be available multiple days during the open enrollment window. As I mentioned, it is open enrollment. Open enrollment is the only opportunity during a year for you to make changes to your benefits. So it is a very important time. The only exception to that rule is if you have what is called a qualifying life event. A life event can be something like the birth of a child, the death of a dependent, a marriage, a divorce, or a significant job change for you or a dependent. If you do have one of those life events, you are eligible to make changes to your benefits, but those life events are not the most common thing. So we certainly suggest that you pay attention and make any changes you need to make at this time. Changes you make during this open enrollment window will become effective on July 1st. And any full-time employee who's working 30 or more hours per week and has completed 30 days of employment is eligible to enroll. The open enrollment window will close on May 21st at the close of business, and you must complete your enrollments on the employee self-serve website. On the screen, you will see just a few of the benefits partners for the city of Hendersonville. As you can tell, there are a lot of entities that are involved in putting together your employee benefits package, and these are just a few of them. Obviously, health insurance is the most important of the benefits to many of you, so we will discuss that first. We do have great news this year. There are no changes in the plan designs, and your payroll deduction rates will not be changing. The biggest change this year is that Cigna will be the new provider for our health insurance benefits. Blue Cross Blue Shield has been our partner for health insurance for many years. Unfortunately, the rates went up to such an extent that the city decided that Cigna was the best option for you. By choosing Cigna, we have been able to hold your cost where it is and not change plan designs. Had we stayed with Blue Cross, we likely would have looked at a worse plan design or higher cost to you, or both. Cigna is one of the largest health insurance providers in the country, and we are confident that they can provide quality benefits to you. You will have two networks from which you can choose. The first two plans, Plan 1 and 2, will be provided in the Cigna Open Access Network. Open Access is Cigna's full network that includes all hospitals and includes all doctors that accept Cigna coverage. The third plan will be offered in the Cigna Local Plus network. Local Plus is a smaller network. It includes Vanderbilt and St. Thomas hospitals. It does not include HCA TriStar facilities such as Hendersonville Medical and Skyline. This is much like the Network S that Blue Cross Blue Shield had for Plan 3, so that has not changed. One other change is Sumner Regional will not be in network. Please keep in mind that this does not apply to a life or limb-threatening emergency. You obviously have emergency protection through any of the plans at your closest hospital. We do suggest that you always check providers to make sure they are in the Cigna network and in which network you should participate. You can do so by visiting Cigna.com and clicking on Find a Doctor. As I mentioned, the plan designs are not changing. You can see those at a high level, and we will discuss each of those individually. Plan 1 is what some people call the base plan. Again, we use the Cigna Open Access Network for Plan 1, and there is the plan design. There are no changes from last year. Plan 1 has a $600 deductible or $1,200 for a family, you see that it says net. That just means that this is your deductible after the city pays part of the deductible through the health reimbursement arrangement. Once you have met your deductible, you will start splitting in a cost with Cigna through what is called coinsurance. You will pay 30%, Cigna will pay 70% of all claims until you've reached your out-of-pocket maximum, which is $2,400 for an individual or $4,800 for a family. In this plan, office visits, as well as inpatient, outpatient, mental health services are all subject to your deductible and coinsurance. You do have a $250 copay for emergency room coverage. You have prescription copays of $15, $45, or $65, depending on the tier of the drug. And preventive services in this plan and the other two plans will be covered at 100%. And that means that anything that is deemed as a preventive service, both by the federal government and Cigna, and is coded as such, will have no cost to you. Those services include things like annual physicals, well woman exams, well child exams, flu shots, COVID shots, things like that. So we always suggest that you discuss with your provider if you believe you are having a preventive service to make sure that those services get coded correctly. You will see there is a part of the deductible that is reimbursed by the city through the HRA. And again, that process has not changed. And as I mentioned, the rates are not changing. So we still offer the 3 tiers of coverage: employee only, employee plus one dependent, that can be your spouse or one child, or full family coverage. The city is continuing to pay a large share of your costs, depending on regardless of what tier you are participating in. And that cost share has gone up, meaning that the city has absorbed the rate increase so that you can keep your payroll deductions as is. And that is something that we do not see very often in today's health insurance world. You guys are very lucky to have an employer who is looking out for you. Again, plan 2, there are no changes. Some people refer to this as the buy up plan. We are again using the Cigna Open Access or the full network for this plan. And the plan design has not changed. In this plan, the deductible is $350 for an individual or $700 for a family. The coinsurance is 80-20, meaning Cigna will pay 80%, you will pay 20%. And your out-of-pocket maximum is $1,350 for an individual or $2,700 for a family. In this plan, everything you do, with 2 exceptions, will go towards your deductible and coinsurance. Those 2 exceptions are, again, preventive services, as I just mentioned in Plan 1, and emergency room. You will again have a $250 copay if you visit the emergency room. That copay does get waived if you're admitted to the hospital. The out-of-pocket maximum on this plan is significantly lower than the other plans, and it is one of the lowest out-of-pocket maximums that you will see. This plan is a very high-end Cadillac type plan. And again, the city is paying part of the deductible through the HRA. The rates on this plan, again, have not changed. The rates you see are the monthly rates, and they are the same as last year. Again, you have the 3 tiers of coverage from which you can choose. Plan 3, again, no plan changes. The plan does use the Cigna Local Plus network. As I mentioned, HCA TriStar hospitals are not in network. Doctors who are employed by HCA TriStar will not be in network. And there will be other doctors and facilities that are not in network. So we do suggest that you go to Cigna.com, determine if your providers participate in this network. The network is very similar to Network S from Blue Cross, for which we used last year. But it is never going to be the exact same because no 2 health insurance companies are the same. One other note is that Sumner Regional Hospital will not be in this network. You do have coverage, as I mentioned, in an emergency situation, but we certainly want you to be aware of the network. The plan design on this plan has a $750 deductible for an individual, $1,500 for a family. The coinsurance is 70/30. Cigna pays 70%, you pay 30, with an out-of-pocket maximum of $2,750 or $5,500 for a family. This plan is slightly different. For office visits, you will have a copay. And a copay is a set amount that you pay when you visit the doctor, so that you will pay $30 for a primary care doctor or $50 for a specialist. You will again have the 100% coverage for preventive services, the $250 copay for emergency services, and the same $15, $45, and $65 copays for drugs. So the plan is the same as last year. The only difference is the carrier and potentially network if your providers are not in that network. The rates, as you'll see, just like the other plans, have not changed. One thing of note on this plan, the employee-only rate is $35. And as you guys know, you can buy that $35 rate down to $0 by being tobacco-free and participating in the WellPoints Reward Wellness Program. So this plan has been designed to give you an option for zero-cost employee coverage. Again, not very common in the health insurance world, and a very generous benefit from the city. A few important notes. Cigna will be giving credit for any deductibles and out-of-pocket maximums that you met through Blue Cross Blue Shield. Deductibles and out-of-pocket maximums run on a calendar year basis. So anything you have accumulated through Blue Cross Blue Shield will be credited to your account at Cigna. And what this means is if you have already met your deductible through Blue Cross, Cigna will give you that credit. We do ask that you be patient. Your plan will be active on July 1st, but it will take a few weeks for those balances to show up in your account. And the reason for that is that we cannot generate the deductible out-of-pocket report until after June 30th because claims could be incurred through June 30th. So we do ask you to be patient. Cigna will put all claims on hold for a few weeks. So you should not be asked to pay anything unless you have a procedure. If you have a procedure and the hospital does ask you to pay something, contact HR and we will be happy to work with the hospital and get you through that transitional period. But please be patient, you will get those credits. If you're on plan 2 and you've already met your deductible, there may be a short transitional period when you fill prescriptions. And again, we ask you to be patient. Cigna has to generate that, or Cigna has to collect that information from Blue Cross that will be generated and credit your account. So please be patient with us. We will do everything we can to make this a smooth transition. And as I mentioned, it is very important for you to check your providers and also your prescriptions. We have designed these plans, and Cigna has designed these plans to match the Blue Cross Blue Shield coverage. However, no two insurance companies are the same. And so we do suggest you check everything. Make sure that your prescriptions are covered. If you have a prescription that is not covered by Cigna, but it was covered by Blue Cross, we do suggest that you get with your doctor and talk about alternative prescriptions. We also suggest that you look at the tiers of coverage. Blue Cross Blue Shield may call a drug a tier 3 drug, where Cigna is going to call it tier 2, where it would be cheaper, or vice versa. Again, no two companies are the same. Everything has been done to keep this as similar as possible, but we do suggest that you do a little bit of homework to make sure that there will be no surprises once the new coverage goes into effect. We always like to remind you a few things. Once you are registered with Cigna, you will be able to set up an account with mycigna.com. MyCigna.com is the user portal for Cigna. Through MyCigna.com, you can keep track of your account balances, your deductibles, and your out-of-pockets. There are tools that let you compare costs between providers. Sometimes providers have different costs, and you can be more efficient if you have that knowledge. You can track all your balances. You can see claims activity. You have the ability to talk to a nurse through Cigna. And then there are a few things that you can do to maximize your benefits. First, always use network providers. While you do have some coverage out of network, if you go out of network, you do not get the credit for the negotiated insurance discounts, and you have higher deductibles and out-of-pocket limits. All of the information that I shared about each plan is for the in-network coverage. You will see, if you look at the plan documents on hviltnbenefits.com, you will see all the out-of-network coverage. So certainly stay in network, you will get a much better benefit. We also suggest you use generic medications when possible. And don't forget, there are generic medication deals through Kroger, Target, Walmart. You can get free antibiotics and diabetic drugs at Publix. Every one of these providers has certain drugs that they provide at a significant discount. Kroger has a prescription drug club where you get significant discounts by joining. I believe it's $36 a year to join. Target and Walmart have some generic drugs that are just simply $4 for a 1-month supply or $10 for a 90-day supply. And as I mentioned, Publix has free antibiotics, some free diabetic drugs, and a few free blood pressure medications. So we suggest that you shop around while you guys have some of the strongest benefits in the area. You can still save money by using these tools. In addition, GoodRx is a great website that lets you compare cost. I suggest that people, especially if you have higher cost medications, I suggest that you go to GoodRx, search your medications there. You may find there are times where GoodRx will provide a better price than insurance. I personally have had that situation. There is no problem with using GoodRx and having the pharmacist run your prescription through them to save that money. So certainly use GoodRx. You definitely do want to follow your prescription dosage information. And then the last thing you can do that will really let you maximize benefits is use Teladoc. Teladoc is a service that the city of Hendersonville provides for every individual who's enrolled in one of the health insurance plans. You will continue to have that access to Teladoc. Through Teladoc, you can talk to a doctor 24/7, 365 days a year for all routine medical issues. There is no copay for the consultation. So if you are a Plan 3 participant, you have a $30 copay to see a primary care doctor. Through Teladoc, you pay nothing. If you're a Plan 1 or 2, your doctor visits are subject to your deductible and your coinsurance. Again, you pay nothing to talk to Teladoc. So it is cheaper and more convenient because you can access it anytime from anywhere. Teladoc has a very quick response time. On average, you will get a call back from a doctor within 10 minutes. Over the last 12 months, we've obviously seen that time be a little longer as people have been working from home. But the last several months, they have gotten back to that 10-minute average. So you will get a call back very quickly. And as I mentioned, Teladoc lets you talk to a doctor anytime. And you can kind of see on the screen several other things you can use Teladoc for. Some of the most common things are colds, coughs, flu symptoms, allergies, bronchitis, UTIs, respiratory infections, sinus problems. And you can use Teladoc, one, for convenience. We always suggest if you are thinking about going to an urgent care center on the weekend because your doctor's not open, try Teladoc first. Urgent care can be very expensive, depending on if the urgent care bills itself as an urgent care facility or an emergency room. Teladoc, again, is free to use. If you're on vacation or you're traveling away from home and you're sick, you can use Teladoc. The way Teladoc works is you will talk to a board certified doctor who is licensed in the state from which you make the phone call. So if you're traveling and you're on the beach in Florida, you will talk to a Florida licensed doctor. I personally have also used Teladoc for short-term prescription refills. I ran out of a medication and couldn't get in to see my doctor for a few days. I called Teladoc and they got me a 30-day extension on a prescription. Teladoc can prescribe medication. They cannot prescribe narcotics, but they can prescribe regular medications and antibiotics as the doctor feels necessary. Again, we suggest you try Teladoc because Teladoc is free to you. And normally, once people have tried Teladoc, they really like it. So it is a great benefit that's being provided to you by the city for no cost to be able to talk to a doctor. Additionally, your entire family can access Teladoc even if they are not on the city's health insurance. So the city has purchased a family Teladoc plan for each person who's on health insurance so that your children and spouse can access that service. That is a high-level overview of the dental or the health insurance coverage. We'll now discuss the dental coverage of the city. The dental insurance is again being provided by Cigna. This year, we will continue to offer 2 dental plans that gives you and your family choice. There are 2 plans available to you, the DPPO plan or the DHMO plan. And as a high level, the difference in those plans, in a PPO plan, there's a network of providers, but it also lets you go outside the network if necessary. There are no referrals required to go to a dental specialist. It is more flexible than the DHMO, but it is more expensive. And what you pay for services is determined by a percentage of cost. The DPPO plan is the type of plan the city has offered for years, and it is a more traditional plan. The DHMO plan only covers services performed by in-network providers. That means that if you go out of network, you are responsible for paying the full cost of the service. And you would also need referrals from your primary care dentist to visit a specialist. The advantage of a DHMO plan is it is significantly lower in cost for your family if you choose to cover them. But the trade-off is there are more restrictions. And what you pay for services is determined by a detailed fee schedule. And that whole fee schedule can be found on the city's benefits portal at hvilleTNbenefits.com. And we'll discuss some of the examples as we go through this. So the DPPO plan, again, is the same type of plan you guys have had. In a PPO plan, you can get your preventive services, which are your cleanings twice a year, every 6 months, and your annual x-rays covered at 100%, meaning you should pay nothing for those if you are at an in-network provider. In your plan, basic services, it's what they call type 2 services, are subject to a percentage once you have paid a deductible. That percentage starts at 70% and will increase by 10% every year in which you go and get preventive services done. So if you were at 70% for last year and you went and got your preventive services done, your percentage will increase to 80, and then 90, and then 100%. So if you have a chain of getting preventive services done, you can get your basic services done at 100%. That is a very rich benefit. Basic services are generally things done to your natural teeth, things like fillings, root canals, oral surgery. So you have an ability, if you're going to get your free cleanings done, you have an ability to build that benefit up so you would not have to pay for some of those basic services. If you have type 3 services, major services, so generally those would be services in which you are replacing teeth, things like crowns and bridges. That will be a 50-50 split with Cigna. All of those services, type 1, type 2, and type 3, will accumulate towards the annual maximum benefit of $1,000 per person. And then the city also covers type 4 services, which is orthodontics, again at a 50-50 percentage. And for orthodontics, there is a lifetime benefit of $1,000. Orthodontic services are only for children age 19 or below age 19, so age 18 and younger. And the rates have not changed for that plan. The dental HMO plan, or the DHMO plan, as I mentioned, you pay a set copay for all services. And you see some examples. Your annual exams, again, have no cost. Your annual x-rays have no cost. Fillings would range anywhere from $0 to $115, depending on the coding. Extractions can go from $0 to $125. Oral surgery can cost up to $850. Periodontics, which is gum procedures, can cost somewhere between $0 and $83. Crowns, you see, bridges. So there is a very set multi-page listing of those services and the codes related to them. So we suggest that you visit hvltnbenefits.com, review those services, and to know how much you will pay. Again, the advantage of the DHMO plan is the cost. You see that it is about half the cost monthly for you to cover your family. But again, we do warn you that you must use network providers for this plan. So please keep that in mind. Visit Cigna.com to determine if your providers participate in that network. The next benefit is the vision insurance. We are very excited about the changes in the vision insurance this year. Again, Cigna will be the provider, but you will notice that the network is the same network that we have used for 20 plus years for the city of Hendersonville, the VSP network. In addition, Cigna will bring you additional providers such as VisionWorks and a few others. So we certainly suggest that you pay attention to that network because it is an enhancement on the benefits that you've had. The plan design is similar in a lot of ways, but there have been a couple of very important enhancements. Through the plan, if you visit a network provider, you will pay a $20 eye exam copay to get your eyes checked. You will also have a $20 materials copay for any materials. The biggest changes that you will have this year is that the allowance for frames, eyeglasses frames, or the allowance for contact lenses has been significantly increased. For years, your allowance has been $105. That has been increased to $180. So a very, very significant increase in benefits for you. You are allowed to get your eyes checked once every 12 months. You can get frames once every 24 months, and you can get lenses once every 12 months. Since we are changing carriers to Cigna effective July 1st, those time frames reset. So if you previously, through Emeritus, got glasses within the last 24 months or lenses within the last 12, you'll be able to start using those benefits fresh as of July 1st. So great enhancement. Again, we are using the VSP network. Again, VSP is going to be the kind of Cadillac of vision networks. So if your provider took Emeritus, they will take Cigna because they take VSP. And there will be some additional big box retailers that you can access. And the other important thing is the rates have actually gone down. So the employee cost is still $0, but the family rate is now down to $9.47 a month. So the vision enhancements are significantly better across the board. In addition to medical, dental, and vision insurance, the city provides many other benefits for you. The first is basic life insurance. The city provides for exempt employees $100,000 of coverage, and for non-exempt employees $50,000 of coverage. In addition, the city provides accidental death and dismemberment insurance equals to 2 times that basic amount. So this basically means that if you are a non-exempt employee and you die in an accident, your beneficiary will receive $50,000 of life insurance and $100,000 of accidental death coverage. In addition, this year, we've added a line of duty rider that will increase that accidental death benefit by 50% for any death in the line of duty for a public safety employee. We want to make sure that any employee that is in that group and who risk their lives gets a greater benefit for his or her family if a tragic event were to happen. This coverage does end on the date that your employment terminates. You can convert this policy to an individual policy within 30 days of termination. If you are in that situation, you contact HR and they will help you with that process. In addition, once you reach age 70, these benefits will start reducing in benefit, or the percentage coverage will decrease. Additionally, the city also offers you the ability to purchase voluntary life insurance. You pay for this coverage. When you buy this coverage, it's purchased in $10,000 increments for you or $5,000 increments for your spouse. You can cover yourself, your spouse, and or your children. One thing to note, you must cover yourself to cover your dependents on this benefit. The cost is based on your age. And again, these benefits will begin to reduce at age 70. And you can see an example of how the cost works on voluntary life insurance. You see that for every $1,000 of coverage, the cost can be as low as 8 cents per month if you are under 30 years old. You see that the employee rate is based on smoker, non-smoker status. You also have rates for your spouse, rates for your children, and a dependent life benefit that lets you pay $1.05 and cover your spouse and children. One important thing this year is for the employee, you can purchase up to $100,000 of coverage with no health questions. In the past, you've had to answer any health questions if you wanted to add this benefit. So it is a great thing that's happening this year that's going to allow you to jump on board for voluntary life insurance up to $100,000 on yourself with no health questions asked. It does not matter height, weight, any medical issue you may be dealing with, you can have this coverage with no questions asked at the $100,000 level. Anything above $100,000, you will pay for the $100,000. Then you will be asked to complete a health questionnaire to get approved for the additional amounts. If you have been approved for amounts above $100,000 already, you will keep that coverage with no questions asked. So this is just an opportunity for you to enhance your coverage to the $100,000 level with no health questions. In addition, the city also provides both short and long-term disability coverage for you. Disability coverage is paycheck insurance. So you pay nothing for this coverage, but the city provides it. This is for non-work-related injuries. If it's a work-related injury, workers' comp will cover that, or any illness. Because the city provides this benefit to you, the benefits that you receive will be taxable income. And you can see that short-term disability will begin after you exhaust your sick leave benefits. The benefit will be paid weekly, and it will replace 67% of your weekly salary for up to 26 weeks. If you cannot do your job, you can be deemed disabled. Your doctor has to say that you're disabled. The insurance company has to agree. The maximum weekly benefit for an exempt employee is $800, and for a non-exempt employee is $500 per week. Short-term disability coverage would end once you've been out of work for 180 days. So on day 181, long-term disability begins. Long-term disability is paid monthly. It pays you 60% of your salary, and that benefit can extend until you hit your Social Security normal retirement age. In long-term disability, an exempt employee who cannot do his or her job can be deemed disabled. A non-exempt employee who cannot do his or her job for up to 3 years and after 3 years cannot do any job can be deemed disabled. And the maximum benefit is $5,000 per month. In addition to some of the insurance benefits, the city offers several other benefits in the employee benefits package. The first is the deferred compensation plan, the 457 plan through Voya. It is a voluntary plan. The city does not contribute. And it's designed to be supplemental retirement in addition to your TCRS coverage. This does allow you to set aside a portion of your wages for retirement, and you can choose whether you want that to be pre-tax or after-tax, or sometimes it's called Roth contributions. You decide within limitations how much you want to defer, and you have investment options. You pick the investment option that's correct for you. There are several ways that you can get paid out. One important thing to always think about is, has your beneficiary information changed? If so, you will want to update that beneficiary information with FOIA. In addition, the city also participates in TCRS. TCRS is a defined benefit plan, and there is a setup formula that sets aside what your retirement benefit will be. It's not based on how well your investments perform like the 457 plan, but it is a plan that sets up a defined benefit at retirement. Through TCRS, the city provides both retirement benefits, disability benefits, and death benefits. You do not contribute to this. The city makes all contributions. And right now, the city contributes almost $2 million per year to this plan. So there's a significant contribution to you. TCRS has plan assets that total over $43 billion. So your retirement benefits are very secure. There is a vesting requirement of 5 years for you to become fully vested in this plan. And once you reach retirement, there are lifetime monthly benefits payable to you. There is a set formula. As I said, you take your years of service, multiply it times your average filing salary, and then there's a factor. So you see an example on the screen, someone whose average final salary is $30,000. They worked for 20 years. They would get an annual retirement benefit of about $9,000. That number obviously increases the longer you work and the higher your salary is. You see all of the things that you can do to become eligible for retirement, both a service requirement, an early retirement benefit, or a full retirement benefit. We suggest that you register for the TCRS self-service page on their website, and you see that link on the screen. Additionally, the city continues to maintain the Well Points Reward Program. It is a program that encourages a healthy lifestyle. It allows you to earn points each year that can result in premium discounts. Those premium discounts, as I mentioned early in the presentation, equal $25 per month as an employee, or $20 per month if your spouse participates. And you can now use those for any insurance benefit, not just health insurance, although most employees use it towards health insurance. You're also eligible to earn a wellness day. And there are a lot of ways that you can earn points. The details on this year's wellness program, or the Well Points program, will be coming out in the next several weeks. So we encourage you to pay attention and certainly participate. And all those information will be available on the city's portal, again, hvilleTNbenefits.com. Additionally, the city does maintain its emergency sick leave fund, which is available to employees who have exhausted all of their available sick, vacation, and compensatory time benefits. You must work for the city for 12 months and donate to the fund to be able to request donations from the fund. Any employee who has a sick leave balance of at least 6 days and is employed by the city for 12 months is eligible to contribute to the fund. Each sick leave day is irrevocably donated to the fund. So if you choose to donate the unused sick days, you cannot get those back. The maximum number of donated sick days you can receive is 60, and sick leave days awarded from the fund are limited. If you have questions, we suggest you contact HR to find out more information about the sick leave fund, and donations are always welcome. We have many employees who benefited from this fund over the years, so we certainly suggest, if you have extra days, that you donate them. As I've mentioned a few times, the city has a portal, hvilleTNbenefits.com. That portal is going to have all of the information that you may possibly need about your benefits. It has plan documents, it has details on all the plans, and it has the ways to contact the different providers. So we suggest that you visit that portal frequently when you have questions. You will have a lot of information there for you. So as I mentioned, all enrollments will be completed on employee self-service. There are no paper forms. HR will not accept paper forms at this point. When you log into employee self-service, you'll make your elections, and you will also need to make your beneficiary designations and confirm your beneficiary designations when you enroll. The deadline is the close of business on May 21st. And it is important, if you do not make elections on employee self-service, you will not be enrolled in any benefit other than the life insurance and the disability insurance after July 1st. The open enrollment is what is called an active open enrollment. The IRS requires you to make elections on an annual basis, and we cannot make assumptions on what you want to be enrolled in. So it is very, very important to make those elections over the next 2 weeks. Again, the deadline is May 21st. If you have questions, I or a member of my office will be on site multiple days over the open enrollment period, beginning on Wednesday, May 12th. And we are available to talk to you one-on-one. If you have other questions, contact HR, and HR will let us know what your questions are. We will be happy to get with you and go over anything that you may need. Again, you have multiple tools available to you, the HFLTNbenefits.com website, employee self-service, but we certainly want to be available to help you personally if you need anything. I appreciate you watching this video, and we look forward to continuing to work with you and help you in any way we can. Have a great day. Thanks.